Buenas tardes, gracias por la invitación. Estoy muy feliz de estar junto con ustedes. Lo presentaré en inglés, pero si tiene alguna duda o si le resulta mejor en la discusión, puedo responder en español. Es una gran satisfacción encontrar a la doctora María Masri. Creo que después de más de 20 años, la última vez que nosotros estuvimos juntos, yo creo que en sul de Brasil, en Bagé, en Curitiba, con el doctor Tonio Silva y el doctor Joaquín Alda, grandes amigos. Qué placer. Mi charla es enfermedad ortopédica de los potros criollos asociadas al sobrepeso de sus madres. Or orthopedic disease of criollo foals associated with brood mares overweight. First of all, I want to thank you for invitation. It's a great satisfaction to be talking with you and living with a select group of professionals. And I also thank the sponsors and all people who made this event possible. I'm from Brazil, the largest country in South America, and we are surrounded by beautiful countries such as Uruguay, Argentina, Paraguay, and Chile, among others. In South America, we are called gauchos, the people who lives in the Pampa biome, and a place where, along with criollo horse, they grow up, learn to live together, and we are benefited by nature and its selection for many years. South America is the birthplace of criollo horse. They are descendants of horse abandoned by the Spanish and Portuguese settlers and selected naturally adapting to the region, its relief characteristics, the weather, food, climatic changes, and disease. The region of Brazil concentrates a large part of breeding of thoroughbred and criollo horse in the country. It's a lot of horse farms, and the horse breeding is a pillar of the economy of South Brazil in our region. The cities of Pelotas, I live in Pelotas near the Atlantic Ocean, and Bagé, near the Uruguay, have several farms that provide studies and research for our group on gestation and foal development and breeding horse. At the public university, which is the Federal University of Pelotas. The nickname is UFEPEL, and I'm an advisor of CLINEC, and the name of teaching, research, and station group on horse, with on focus in equine medicine. We work with some professor, students, and veterinarians, master students, PhD students, and undergraduate students. And I have some colleagues, and it's the main colleague of our group, Dr. Bruna Curcio. It's a former student of us, and now it's the biggest colleague, and we work together many times. Here are some papers that we've been produced in recent years by our research group. Many papers published on Brazilian Journal and others in international journals. In the South America, the criollos horse are organized by Federación Internacional de los Criadores de Caballos Criollos, FIC, and there are some associations in some countries like Argentina, Uruguay, Paraguay, French, Italy, Germany. In the next slides, I will present three pictures, on some pictures about the Criollo's horse in competition. It's Freire de Ouro, the most important competition of Criollo's bred in the South America. In this competition, the horse needs demonstration the biggest conformation and skills like speed, ability to change in direction quickly, turn on spins, work with cattle, and we call these skills near habilidade vaqueira. It's like a base for a field horse and like a working cow horse in American Quarter horses. The Brazilian Association of Criollo Breeders, ABCCC, requires animal to present to accredited technician for 24 months. The foal was born, and after 24 months needs checking for receive a definitive registration. The animals are expected to verify that have a racial standard, the characteristics, the specific measures like a height, thoracic, perimeter, and cannon bone. However, not all animals can have the appropriate measures, which results in use the numerous techniques and other things to promote the growth in these animals. It's a bad things the people do. It's important that the breeders know the growth curve of their animal to carry out the technical selection based on scientific data. This evaluation avoid wasting resource in animals that do not present expected development, directs corrective procedures in health and nutrition for these animals, and avoids frustration and with the morphological performance. There are many breeders that put a lot of money in that foals and have a big problem. Access, conformation, growth curve, nutritional health, these procedures performed yearly avoid losses in investments in animals with low performance or serious problem. It's the point. The point is what is needed for horse breeding. To breed a horse, you have keep in mind the importance of these factors, as they are crucial in any breeding. All year factors must be together to reach the end goal, like a planning, team, genetics, management, labor, facilities, good facilities, welfare is so important, guidance and dedication. Our team, after the genetic selection, we did a pregnancy evaluation, and it's necessary take the marriage history, like age, how many deliveries, how many problems with pregnancy, and morphological and functional competition that mares was in the last years. And the body scores, the attention about the expectation of date of delivery, and the nutritional support like maintenance, lactation, and the new concept. So necessary to understand. The pregnancy is also recognized as a period in which several endocrine changes occur in the body, which are physiological, necessary for the growth of the fetus. Different hormones involved in the gestation physiology may present change results from obesity and be related to change in fetal development. Fat mares can exacerbate conditions that occur in physiology during the gestation period, making them more susceptible to development and harmful changes for both themselves and their offsprings. Data relating these variables are markers of newborn health are still scarce, but in human medicine, changes have already been identified in children born to obese mothers. And nowadays we have one more data about mares, and the last year we have some papers about this. You did a little bit review about alert, a contemporary problem that obesity and overweight during the gestation period, the possible reflex of this problem in the offspring if focused on equine species. It's some articles or papers in epigenetics, fetal programming, pregnancy, and important facts that influence fall development. I'm so happy to still here after Dr. Robles and other important colleagues that study these topics. One more time, the gestation period in the mare is characterized by the increase in the insulin response to glucose and decrease in insulin sensitivity. It's during part of gestation period insulin-mediated glucose uptake is reduced. In some cases, be identified a state of hyperglycemia. This mechanism in the mare was described in 1984 for fully unfolding, and is related to a process and maternal adaptation that guarantees a supply of glucose to the fetal placental tissues, which is the main source of energy used to the growth of fetus. For this occur a physiological without need to maintain constant hyperglycemic state during the gestation period. The pancreas islets undergo the structural and functional changes, which promotes an increase in the insulin secretion, even normal glucose levels. The authors identify that the periods of lower insulin sensitivity compromise approximately from some days to 270 days of gestation, coinciding with the period in which great fetal growth occurs. The increased insulin response to glucose is mediated by increased insulin synthesis and secretion by pancreas, peripheral tissues, resistance, and placental hormones that regulates a pancreatic B cells function. In this work, objective was to describe the dynamics of glucose, insulin, and cortisol curve in a pregnant mares, and from these data to evaluate the curve according to the body condition scores during the gestation period, identifying the presence of insulin resistance and this relation to weight and height and clinical changes of neonates. It's our study. 26 pregnant mares, multiple spawning, were used with mean age 11, from 5 to 70 years old. This experiment was conducted during the breeding season 2016 in South Brazil, in Rio Grande do Sul. And the mares were evaluated by the same trained observer 2 times of data collections according BCS, following the system described in Heineken in 1983, and separated into three groups. The animals have had a body condition scores between 5 to 6 out of 9, who are included in the group 1, and classified animals and a moderate body score presenting means the weight in 350 kilograms. In the mares identified with a BCS of 7 out of 9 were included in group 2. Corresponding group of overweight mares present a mean of weight in 452 kilograms, and mare presents a BCS greater than 7 out of 9 were considered obese and were included in group 3, with means they weight in 523 kilograms. All data collected in this study were approved in an ethical community, and it's our research. Some results: the glucose insulin curves of all mares during gestation length, independent of groups, baseline and after 60 minutes of challenging with corn syrup are shown in the graphs in figure 1. And baseline glucose and insulin variables remain in the normal reference range in all time points. After corn glucose administration and increase in glucose insulin from baseline values at all moments can be seen, with the exception for insulin in the second moment, like this. At falling, a greater increase in both glucose and insulin values. It's here and here. And both baselines and 6-minute glucose during parturition were different for remand moments, and significant decrease in glucose insulin value post falling occur in all variables. It's our results, and part T test showing the significant increase from basal glucose insulin values compared to post oral syrup test at time points in both variables except insulin levels from the second moment. And no difference was found in cortisol concentrations between moments, disregarding the group separation. Insulin concentrations remain with a normal reference range in all moments in figure C. No difference was found between the groups in any moments. After glucose administration, insulin levels were increased in group T when compared in group 1 and group 2 at falling. It's an important result. No difference was observed in the remains moments. Although no correlation was found between maternal insulin and glucose levels with the weight and height of the neonate, at present data show that in the groups of obese mare, maternal weight and full birth weight relation of 8.49% was obtained, and the overweight group had a relation at 9.25, being significantly lower than the group with moderate BCS. According to Brown and Douglas, the weight of the neonate should correspond to 10% of the body weight, which is considered a reflection of placenta efficiency. And Smith have identified the inverse relationship between body score and full weight at birth than what we found in the present study, observing the mares with higher body scores gave birth to heavier foals. At Pearson correlation test, no correlation between newborn's weight and height with mare's glucose and insulin concentration was found. However, mare's weight correlation with newborn weight and height gestation length correlated negatively with newborn's weight, and the relation among the mares and foals' weight correlation negative with mares, based on insulin concentration at foaling. The relation of maternal weight and foal's birth weight correlated negative with mares. Fasting insulins at parturition show that mares with higher insulin concentration at foaling and had lower weight percentage relation between mare and foals. All the foals presented normal clinicians' findings in all groups. Regarding the physical features, only foals from group 2 and group 3 present a mild alteration. Changes like angular deviation 1 in 19 and flexural deformities, including the hyperextension and hyperflexion of flexor tendons and hidden front limbs 7 to 19, and bulging of frontal bone in the head were observed in 6 to 19. It's also observed that the measured physical alteration present by foals in group 2 or 3 at birth are consistent with immature. That influence and foal development. We must consider that physical growth is characterized by the sum of cellular, biological, biochemical, and morphological phenomena, being genetically predominating and only influenced by the environment. We did other study in Criollo's foals about conformation, and the conformation of the limbs, the foals, the future athletes has become the focus, the attention of physicians and breeders in the last 20 years. Due to the contribution of poor conformation, a high incidence of musculoskeletal disorders, and consequently a great economic recovery of individuals with correct angulations. The aim of this study was to identify the main angulation disorders in Criollo foals from the 1st to the 8th month of life, highlighting those that are the most frequent. This schema is an interrelationship between the various congenital and acquired factors and involving development deformities, like congenital factors and acquired factors. And our results in a total 77 foals, the generation 2007, were evaluated. They are chosen by a process, a simple run simply of total 154 foals raising proprietary analyzed. And the study was conducted in 2 stages, like the first evaluation was performed with animals with the 1st to 4th month, the age, and the second and the 5 to 8 months, the age. Considering the 2 evaluations, the main and angular defects observed as toe-in, which was observed in 47 foals. This picture is in the first evaluation, the second evaluation in each problem, or like a deviation, carpal and dorsal valgus and varus in this, and toe-in and toe-in out here. And could you check how many cases you have in the foals. The identification of defects in the angulations after birth in this appearance and extremely importance to veterinary, allowing immediate intervention by performing trimming and change the management and surgery for correction of this angular deviation. We concluded there are several factors involving development, angular deformities and deviation may spontaneously regress, such as a carpus valgus alterations. And however, the toe-in, the angular deviation, did not regress spontaneously, being the main alteration in criollophos. The toe-in is a big problem because the criollophos is a large chest and the foot goes in. We did another study was conducted in 3 criollo horse breeding farms in the south Brazil in a period of 2003-2015. We found 267 criollo falls for birth to 24 months to the age. By biometric evaluation, dividing the 26 periods with 40 animals in each and random repetitions of individual. And we produce a growth curve of criollo falls from birth to the 24 month. And we measure these falls monthly using a mechanical scale and waiting for a hypometry for high. The results showed increase the weight and height for the 24 months. Is obviously this increase was accentuated during the first months. It's important in Aubrey breeds. It's possible to observe that the first 6 months of life characterized by a large growth rate, and is therefore essential for the full development. Require special attention from breeds and owner like this time. Its relation weight. It's the curve of the weight. It's more sequential. In the growth curve obtained show that not all individuals reach the dimension required by the Breeders Association. Corroborating to the empirical observation, it's a problem of the breeders and technician in their routine. This is also a concern related of the other Brazilian breeds such as Manga Larga, Pantaneira, and Campeira. For the mentioned breeds, the adequate curve has already been described, the control for development. The Brazilian Breeders Association required that foals at the 24 months of age have a minimum 1 meter and 4 centimeters for males, a meter for 38 centimeters for females. Using hands in United States, you need exchange. And these foals needs this measure to receive a definitive mark. The association brand and the permanent register only this horse or foals. According to the growth curve, the first 2 months of the foal's life show the largest growth rate, reaching 78.4% of adult weight or height, with an average growth of 20 centimeters, reach a meter 0.05. Genetic features, nutritional and sanitary conditions directly influence this period. The overweight associated with exercise increase the risk of musculoskeletal injuries, and represent a factor for stress of the joints. This should be a concern among Criollo's breeders, and the knowledge of their growth curve is important for an objective assessment, seeking a gradual and waiting development. In this work, it was possible to determine a growth curve of Criollo foals in the south Brazil from birth to 24 months. It's important to check this from birth the second month. This period is so important, like the other breeds, but we have the results in Criollos. Check the how many centimeters the foals growth in this time, 20. Prophylaxis. The growth rate and skeletal maturity can be evaluated by body weight, height, and through X-ray examination of the skeletal system. And using this method and following the development of foals, it's possible to diagnose change in development, assess the cause, and intervene at the appropriate time. It's necessary. We conduct the other research. The name is the relationship between the pose, energy profile, inflammatory proteins, and osteoarticular lesions in young horse in different rearing systems. It's a kind of management of Criollo's foals. Lives in a field in a high carbohydrate diets are increasing being used in the horse rearing system. It can result in the weight gain and fat accumulation in young horse. There is an increasing incidence of juvenile osteoarthritis and other inflammatory conditions in overweight young horse that undergo intense physical exercise. The aim of this study was associated corporal adiposity with energy profile, serum concentration of acute proteins, and presence of OCD lesions or osteoarticular lesions of the tarsal region in young horse raising in two different rearing systems, an intense that foals receive food and high energy, and extensive system, and the foals lives in outside and receive only a grass. It's a example the cultivated grass in our region, like a bluegrass, the Lolium multiflorum, and Avena, and Trifolium wrappings in Lotus corniculatus. It's a mix of grass that you cultivate here, and with a high content of soluble carbohydrates, fructans, among the others. There were evaluated 40 young horse aged 18 months old. 23 of them were females and 17 were males. 20 horses were raising in extensive rearing system, and 20 others were raising in an intensive system. The blood samples were collected in biochemical analysis, and protein electrophoresis did. Check the fat deposition in these points in the crest of the neck, in the tail head, on the back, in the peritoneum, and use ultrasound machine. It's a colleague that did these exams, and you did X-ray the images that left tarsus. You use only this one, and was performed in 70 horse because we lost some foals in this It was observed higher levels of cholesterol, LDL, glucose, serum amyloid A, transferrin, haptoglobin, X-glycoprotein, and other unidentified protein uh, with a 23 kilodaltons in horse in an intensive system. This horse also show higher fat deposition on the crest and the neck of the neck, peritoneal and tail head than the other horse raised in the extensive system. In a horse on the intensive system group that underwent a radiographic exam had lesions compatible with a juvenile osteoarthritis, while only 23% of the animals on the extensive system group show such changes. In the conclusion, the fat deposition on a crest of the neck has a relation with energetic profiles change, acute fat proteins change, and with articular injuries. Levels of glucose, LDL, cholesterol, acid protein, haptoglobin, ceruloplasmin, transferrin, and SAA have a correlation with a deposition on crest of the neck. In addition, young horse and intensive rating system are 105% more likely to have chronic degenerative joint lesions compatible with a juvenile osteoarthritis than horse. Here in extensive systems like these images. And it's a kind of lesions in 100% of the lesions and the intensive reading. 23 it's light, 35 moderate, and 41 severe. And it's a situation that I think, because this horse lives in a field eating grass, and two of these animals have a joint image compatible to DOD. In another study, we continue to work with musculoskeletal changes in growing foals can be linked to metabolic disorders which affected cartilage metabolism associated of obesity during the late gestation of the mares, and negatively affecting the athletic performance of the otherwise prospective foals. High basal insulin levels can be associated with increased weight and obesity of the mares, altering the supply of glucose to the fetus and produce EGF-1, which plays an important role in the endochondral cartilage metabolism. In this study, the aim was described the association of metabolic and biometric alterations in overweight Creole mares with AGI, EGF-1 levels and presence of articular physical lesions in their foals. The method of this study as a prospective and observational cohort study, and was conducted using the foals and the overweight mares at field conditions. 28 foals and their overweight mothers were utilized. In the foals, biometric and metabolic features are weight and high glucose, cholesterol, HDL, triglycerides, insulin, leptin, glucose, T4, EGF-1 were analyzed from the birth until the weaning period, around the 6 months of life of it. All the foals at the winning period were submitted to the radiographic examination of tarsal joints and metacarpal phalange joints to evaluate signs of lesion and possible distal metacarpal physiological change, respectively. The mare's biometric and metabolic features are weight, height, and fat tail head deposition, basal, insulin, leptin, glucose, cholesterol total, cholesterol and ideal triglycerides melanized at the final of gestation period. Shown here in the three tables, but the more important, the basal insulin levels of the foals and the second, fourth, and fifth month of the life. It's 9. It's here, and 99. It's like the same. And when you check this table, we observe the animals have a joint problems in metacarpal like 50% and a tarsal 22%, and the high number of these lesions. I think it's the when foals present osteochondritis in the distal tarsus and metacarpal physial plate. The weight of the basal insulin levels and the mares in the last 3 months the gestation where it's high. It's an important result to check. It's another mare like the first one that I show when I present this paper. Check this neck, the big fat area, and it's the foal in the first week of life. In this field have a lot of mares in this condition. In the present stud from the 2nd to 6th month of the period of life, the foals show the HF1 levels 220 to 18. We check this table. It demonstrates the 6-month-old prevalence in 92% of distal tarsus lesions. In association, the overweight mares show increased insulin basal levels when near the parturition, and we checked the problems in the foals. The lower levels of IGF-1 level during the developmental period of foals are associated with a decrease of bone density and mass, muscle skeletal atrophy and osteoarthritis. In the present study, the decrease curve of IGF-1 levels of the foals from the 2nd to 6th month of life is similar to others researchers with foals from other breeds from 0 to 7 months of life. It's the previous research with a Criollo horse about this condition. It's a typical X-ray imaging in femoral cysts, and a radial is the same in osteochondrosis. And now we think about for the next steps in our studies. If following the examples of other breeders, the next steps are related to research to determine origins of metabolic alterations and the presence of genes responsible of the orthopedic alterations in crude breeds, like many papers that we study. And I put on this about the 10 years of horse reference genome, and I mark the metabolic syndrome in the Criollo's horse there are a lot of animals with a metabolic syndrome, and you need to check these genes and osteochondrosis the same. And the other problem that we found in the Criollos, it's a stereo reproduction problems. And there one more table about hereditary orthopedic disease, and I use only to present for yours, and I intend continuing our study. Here I put a photo in a field in a horse farm near our university, and the horse lives in a field, and the PCS of the mares, it's cool, and we check the horse, the foals, and the increase in the grow in the like a ideal condition. But when you check the knees, you need to take note about the possible problems that we see. Thank you so much. I'm so grateful to stay here. Gracias a todos. Estou à disposição para as perguntas and questions. Thank you.